Hey guys, welcome to another episode of the 4 Pillars of Health with Kevin Davis. Today we are going to talk about the carnivore diet. You know, the carnivore diet is just one of the tools that we use in our selection of what kind of foods that we should be eating for certain situations. Today we're going to talk about who needs to do the carnivore, why should you do the carnivore, who shouldn't do the carnivore, and some of the benefits that you can get from the carnivore diet. So stay tuned, and at the very end we're going to talk about a challenge that we may be starting, and it's going to be something that I think you might be interested in. So stay tuned to the very end. So today, let's talk about the carnivore diet. Now, what is exactly a carnivore diet? Carnivore diet is a diet that is mainly made up of eating meat. And what I mean by that is pretty much any kind of meat is on the table for this. Now, there's some meats that's better than others. You know, ribeye is much better than the processed foods like sausage or maybe even bacon. Eggs can be included on it. But what we're going to do is we're going to eliminate all the other foods. We're going to eliminate fruits, vegetables. And a lot of people, when I say that, the first thing that pops up in their mind is, hey, this is unhealthy. Fruits and vegetables are healthy for you. And I agree to some extent. You know, it depends on your situation. Where are you at? So when we talk about the carnivore diet and the benefits of the carnivore diet and, you know, who should do the carnivore diet, you're going to find out that sometimes having this tool in your tool belt as a different type of diet for a different type of season that you may be in is going to be beneficial for you. So the first thing that we need to talk about is why do a carnivore diet? There's 3 reasons why I think doing a carnivore diet is beneficial to your health. 1, it heals your body. And what I mean by that, so many times the foods that we're eating cause a lot of inflammation. Now, inflammation can cause a lot of long-term consequences and even short-term in some aspects. And we're going to talk about some of the things like that in just a second. But what it does is it heals your body. It's taking away a lot of the sugars, actually taking away most of all the sugars. It's taking away processed foods and some of the plants that can cause harm to you if you are in an autoimmune state especially. So healing your body is one of the reasons why doing a carnivore helps. Another reason is we can use it as an elimination diet. So many times I have patients or clients that come in, certain things are causing them to be inflamed. Their joints may be bothering them. You know, they may have some skin rashes. They may have headaches. They may have some GI disturbances. So what we do is sometimes we want to do an elimination diet. And basically that's getting rid of a lot of foods and just eating a basic diet to begin with. And we're eliminating all the other foods. And that's where the elimination diet comes into play. So if you're eating a carnivore diet, you're eliminating the other foods that can cause these long-term and short-term symptoms and problems. So when we do the elimination diet, we do the carnivore diet, and then we start adding foods back in one at a time. And if you start having reactions to certain foods, then you know you need to probably stay away from those foods. And the third thing that I think doing the carnivore diet is weight loss. So many times I've had people come to me struggling and, you know, they may have tried ketogenic, which I'm a fan of. You know, I do ketogenic myself. But, you know, sometimes those extra carbs, extra starches may be holding someone back. We put them on a carnivore diet and they start doing so much better and they get results. Now, when someone does a carnivore diet for any of these problems, you know, healing, elimination diet, or weight loss, does that mean you have to do it the rest of your life? No, you don't have to. And I don't do it for all time for myself. But what I do is I use it at certain times in my journey as far as my health as one of the tools. And we'll talk about how I use carnivore diet towards the end. Now, some of the benefits of carnivore diet. 1, obviously, is weight loss. We just talked about that. Losing weight on a carnivore diet is pretty much across the board. People do really well with this. And the type of weight that they lose is probably more important. And what I mean by that is when you lose weight, you're going to lose fat, but you're also going to lose muscle. If you're eating a carnivore diet, you're getting a lot of a protein into your body, and it helps, and that's the amino acids. When the amino acids are in the protein, those are the building blocks for your muscles. So you'll be able to maintain that muscle mass and hopefully even increase it while you're losing weight. The second benefit is autoimmune. That's what I'm talking about when I talk about Crohn's disease for your GI system, rheumatoid arthritis, Hashimoto's thyroiditis, some type of a thyroid condition that a lot of people have. And these autoimmune diseases are when your body attacks itself. It's sensing something's wrong and it attacks different organs or systems. And it can really wreak havoc on your overall health. People don't feel good. They are constantly dealing with these situations. So having carnivore diet can help offset some of the autoimmune diseases. Now, if you have any of these, now the one thing you need to do is talk with your medical provider to see if a carnivore diet is something that is good for you. Not one size fits all, and we need to make sure that not we're going to do anything to harm ourselves, but it may be a tool that you can use to offset some of the conditions and symptoms that you're habit. Third benefit is if you have insulin resistance or diabetes. Now, insulin resistance and diabetes, usually it's a sugar problem and increased production of insulin. Obviously, if you're doing a carnivore diet, you're not going to be taking in the sugar, which is going to offset the increase in the insulin, and you're going to have a more of a steady state low insulin production. And the insulin resistance, which can lead to diabetes, is going to be potentially reversed. You're going to be able to get results from just your diet. It's probably more effective than medication as far as like overall health, because the things that you put into your body is going to be paramount to the disease progression. The fourth thing that the carnivore diet can help is with hypertension. Hypertension is a state of inflammation. It can be caused from many different things. There's a lot of conditions that we're not 100% sure what causes your blood pressure to be high. There's probably 5 or 10% of the known causes, but the majority of people who have high blood pressure, we do not know the reason. I personally believe, and this is just my thoughts, is I think it's a lot of the lifestyle issues. It could be underlying inflammation. It could be the insulin production somehow affecting your blood pressure, because it has a lot to do with your blood vessels, the way they dilate or constrict, and that leads to increasing your blood pressure or decreasing your blood pressure. So I think with a carnivore diet, we do see some benefits with high blood pressure. And the other thing is genetics. One of the things that does help as far as overall, if you have the right genetics to eat the right kinds of foods. Now, if you have certain genes, you need to be careful about saturated fats. And I'm going to talk to you a little bit about my journey to end and what I can do and the things that I personally have to watch out for. So when we talk about doing a carnivore diet, we have to kind of like do one step further sometimes to see what your genetics are. If your genetics are a certain way, then you can still do the carnivore, but you have to kind of adjust how you do the carnivore, and that's going to be able to help you get your results without causing any further harm. So hopefully that's helped give you some ideas of what the carnivore diet does, how it can help you. Now the question is, how do you do the carnivore? Do you just eat meat? And the answer is yes. But there are some things that you need to think about as you do the carnivore diet. The first thing that I try to tell people is, especially if you like meat, and I'm going to tell you to eat all meat and that's all you can eat, and you think, hey, this is great, I can do this. But so many times when I do the carnivore, I get tired of eating meat. So the one thing that I always try to tell people is it's going to maybe be fun at the beginning, but it's going to get old. But once you start seeing the benefits, you're going to even get hooked more on doing something like the carnivore. So try to do it at least 2 weeks. Give it a good shot. A month is more preferable. If you could do this for a month, you're going to see results. You're going to start feeling better, and you're going to be able to do this more easily because you start feeling better. If you start feeling better, it's a lot easier to keep doing the things that you're doing. Second thing we need to think about is eating enough. So many times it's ingrained to us as far as like how many calories are we eating and those type of things. But what we want to do is we want to make sure that we're eating enough. So many times people, I think, fail doing a carnivore because they still try to watch calories. And at the beginning, you're going to probably eat a lot. But as time goes on, you're going to find that you're only going to eat maybe 2 meals, at the most 3 meals a day. Some people even do 1 meal a day. What we want to do is when we're eating these meats, we want to make sure that we're getting fats in the meat as well too. It's important to get fats because there's overall health with your brain health and things like that, and it helps with the energy as well. So what I try to do is on a consistent basis, I try to do 1-to-1 ratio of fat grams to protein grams. So if I'm eating 100 grams of protein, I'm going to try to have around 100 grams of fat, and that gives you a good ratio. One of the best meals that I think that you can have is a ribeye with eggs. If you eat that type of meal, you're getting a lot of nutrients from both of those types of foods. And if you look at the ratio, it's usually a 1-to-1 fat to protein ratio. Number 3 is eat fatty meat. That's what I just talked about. Make sure that you're including some fatty meat. Is it okay to eat chicken? Is it okay to eat pork? Is it okay to have some shrimp? Of course it is. But you want to make sure overall, not necessarily every day, but on a weekly basis, that you're getting some fatty meats, and it's going to help you with your satiety or your hunger. Number 4 is make sure you have some salt. You want to use salt. And number 5, we're going to talk about electrolytes. We'll include that as well too. You want to make sure you're getting these electrolytes. There are some pre-made electrolyte solutions that you can use, and what you want to look for is magnesium, potassium, and sodium. Make sure you're getting those into your body, and you're not going to have those episodes where you feel weak, dizzy, things like that. Number 6, you're going to eat nose to tail. And what I mean by that, so many times when we say eat carnivore, the first thing you think about is what? You think about eating a steak, and steaks are fine, but you need to include the other parts of the animal as well too, and that's what we're calling nose to tail. You need to have collagen. You need to have some organ meats. Now, organ meats for me, honestly, is the hardest part for me to eat. We've tried it different ways. We've tried it fried. We tried it with onions, grilled onions. People have done that before. We just have a hard time eating eating this. And I think that's one reason why I don't want to do the carnivore all the time. But if you can eat organ meats, it has so many nutrients in it. It's nutrient dense. And if you eat that, you're going to get all of the nutrients that you need. And number 7, you need to incorporate some bone broth. And that goes along with the nose to tail. You need to make sure that you're having some bone broth that has different types of collagen, and it helps with the muscles, the tendons and nails and hair and things like that. So you want to make sure that you're including those. So the important parts as far as like how do you do the carnivore is, of course, eat fatty meat. Try to have a 1-to-1 ratio of fat to protein in the grams. And you want to make sure you add the electrolytes to your diet, either salt in your food or having electrolyte solution. So one of the things that I think is important is when someone is talking about carnivores, how do they do it? How is it incorporated in their life? And with me, the thing that I want to do is I have a variety. I like different types of foods. I do like meats, probably my favorite if I had to rank them as far as like meats and vegetables and fruits and things like that. But I do like to have occasional fruit, and I do like to have some salads and things like that as well too. So I don't want to eliminate those things from my diet, but I can use the carnivore as a tool. So like if I come back from vacation, if I have a holiday week where I eat things that I shouldn't eat, sometimes what we'll do is we'll do a carnivore diet for a couple of weeks. It kind of resets to where we're at. So that's where we're at in our stage of our life. You may be somebody who has a severe autoimmune disease, and you may need to do this for 6 months or 12 months and before your body really starts healing itself. It depends on your diabetes. If you have really significant diabetes and it's difficult to control, you may need to do it for a longer period of time compared to someone who is just developing the insulin resistance that leads to diabetes. So it's a case-by-case basis. You can use it as a tool. You don't have to do it all the time. Some people I know, I've listened to so many people that I know are very knowledgeable in this area. They've been doing it for years and they feel fine. Their lab markers are great. And that's something that I think is an individual basis. And that's something, if you ever want to have a conversation, we can talk about lab markers and things like that as well too. The one thing that I talked about earlier was genetics. And as far as like for me, there is a genetic, it's called ApoE. And basically you get one number from mom and one number from dad. And those numbers are either a 2, 3, or 4. So you can be a 2, 2, 2, 3, 2, 4, 3, 3, 3, 4, 4, 4. You just put all those two numbers together, all those different combinations. Now, if you're an ApoE 3, 4 or 4, 4, the one thing you really kind of watch is a saturated fat. It's associated with increase of like heart disease, possibly dementia, mostly heart disease. So if you have an ApoE 3, 4 or 4, 4, you want to watch doing it. And with me, like I said, I'm a 3, 4. So I have to watch the saturated fat. Doesn't mean I don't do carnivore. Doesn't mean that I can't incorporate some chicken and some other things that doesn't have the fat in it. And I do well with it. I still continue to watch my lab markers and they do not go up. So there's different labs that I look at and we can talk about that later on as well too. But with a carnivore, I think it's good to have something in your tool belt that you can use for those times when you need to have a reset. If you get off the wagon, and whether it be a summer vacation or be a holidays, and for several days you do things that you normally wouldn't need, it's good to kind of reset that. And I think it's just a great tool that you can use short term and also long term. I think either way is fine. You just have to find what works best for you. And sometimes, working with a coach like myself, sometimes having somebody help you through these decisions that you need to make is going to get you where you want to go. So hopefully this has helped give you a little bit about carnivore. We are going to possibly do a carnivore challenge. And what I mean by that, we're going to invite you to do a carnivore for a couple of weeks and maybe even have some conversations with you through Zoom or something like that as a group to see how you do with the carnivore, how you feel with it. And sometimes if you can have somebody talking with you through the first couple of weeks, you can get by those roadblocks that seem to get in people's way. So if you are interested in that, go to our website, leave us our email. You can download our free sheet that has 10 questions as far as are you healthy or not. We'll collect your email and you can be on our email list and we'll be able to update you when we decide to get this started. I think it'd be very beneficial for people that are not really have a lot of knowledge about carnivore. It'd be beneficial for people who need some accountability to do carnivore and want to see other people having the same questions and struggles that you do at the beginning, and having some people in your own court is going to help you get the results that you want to get. Anyway, we'll turn our attention to our catechisms. Today it says, is God pleased with those who love and obey him? And he says, yes, I love them that love me. God is a wonderful God. We are in a presence of a almighty, all-knowing God. And the thing that he wants to have with us is a relationship with him. And having a relationship with him is getting to know him. And once we get to know him, we just love him. We love him for the sacrifice that he made on the cross for you and for me. And we just want to reach out and just encourage you. If you haven't made that decision to follow the Lord Jesus Christ, do so today. Anyway, that's the end of today's video and podcast. And if you have any questions, remember to reach out at KevinDavisHealth.com. We would love to have conversations with you. We look forward to seeing you guys next week. And remember, be fit and be faithful.
This podcast is for informational purposes only. No patient-provider relationship is implied or established. This podcast in no way represents the practice of medicine. The information given is to be used at the listener's own risk. Please consult your provider before making any changes, as the contents of this podcast is no substitution for your provider's instruction.